Well, it seems to make sense to talk about eating disorders in a nutrition class. To be quite honest with you, they fit a little bit better. This concept fits better in a discussion about mental health. And in fact, when I teach BPK 140, that's where I fit this topic in, because although, yes, there is a change to food consumption, really these conditions are more psychological in nature. Food is more of a symptom of something else going on psychologically. So as far as risk factors for eating disorders go, there isn't one. There isn't like if this person has X, Y, and Z, they are likely to get an eating disorder. It can happen for a number of reasons. Genetics does play a factor. In fact, with certain eating disorders, changes to the genetics that are associated with appetite are risk factors for an increased risk of eating disorders. Females are more likely. Also, the social cultural factors like the pressure to be thin or the pressure to be perfect or to fit in or to have a certain type of body. And there's certain personality styles like perfectionism, sensitivity towards reward and punishment. These are also associated with a higher risk, as are a history of sexual and physical abuse. And speaking a little bit to that social cultural factors is why I put this up. So there are so many messages out there that are all about being thin, and it doesn't even matter what's going on, you know, there is just still this pressure that comes out. So beware of the COVID-15 symptoms: stress eating, laziness, and weight gaining resulting from the COVID-19 crisis. Similar to the freshman 15. So this is a meme, but my point is actually this was posted by a health organization, which is not something I'd like to see from that, because it promotes this thought that we have to be a certain size or we have to be afraid of gaining weight. And this is something that can get into people's psyche and predispose towards an eating disorder. But again, they're multifactorial in nature. So we're going to highlight 3 different eating disorders that are recognized by the American Psychiatric Association, and then we'll highlight 2 others that are kind of still being explored a little bit further. But 2 of these main eating disorders, binge eating disorder and bulimia, both of these involve binge eating. So I wanted to have a slide specifically on binge eating to cover that first. So when we say binge eating, this is different than overeating. We all overeat sometimes. Think Christmas, think Easter, think Ramadan, when people break fast. There's a lot of eating that occurs. And there's nothing wrong necessarily with overeating, as long as it's not done all the time. But binge eating goes beyond just eating too much. One of the main characteristics that we see in binge eating that distinguishes it from overeating is this loss of control. And you might be reading this and be like, I don't understand. Like, how do you lose control? And I'll share with you that I've, experienced both binge eating disorder and a form of bulimia. And I can't explain to you why I couldn't stop, where this loss of control was coming from. My brain would be saying, stop eating, stop eating, stop eating, but I couldn't actually stop. It was literally like there was a monster inside of me. And the reason I picked this picture is because someone that is binge eating, they might do it like hiding from people. That is one of the main characteristics of it. They hide from people, they do it alone, they do it often in the absence of hunger, they do it really quickly. And a binge eating episode typically occurs in a 2-hour period, and it's often followed by feelings of shame and guilt, which is actually predisposes to other episodes of binge eating. Okay, so now that we understand what binge eating is, we know that binge eating occurs in both bulimia and binge eating disorder. In bulimia, the binge episode, that 2 hours, 1 hour of binge eating is followed by some sort of compensation. So when I say compensation, typically people think of throwing up, of vomiting, and that's one of the main manifestations of bulimia. I personally had a form of bulimia where I would binge eat and then I would over-exercise. I would go to the gym and I would say I'm not allowed to leave the gym until I burn X amount of calories. And you might be thinking, well, that doesn't sound so bad. But the issue is that there's something going on psychologically that does not feel good. And there's an obsession or there's a preoccupation. And this disorder can be very consuming in various aspects of a person's life, and it feels like it can take over a person's life quite quickly. So the compensation is usually vomiting. It can be excessive exercise. It can be laxatives as well. Some risk factors for bulimia include a preoccupation with food, thinking about food all the time, distorted perceptions of body weight, like they might look at themselves in the mirror and they think that they're so heavy, whereas someone else might think that they look perfectly okay, right? We see an increased association between depression and bulimia nervosa, and frequent dieting. We often see bulimia more likely to occur in people that are like obsessed with diet or really wanting to achieve a particular body size. As far as how this can negatively affect us beyond the negative mental effects, is that it can really, if someone is vomiting, it can really damage their teeth. Because think about it, if someone's vomiting, they're bringing up acid, and that acid can really destroy the enamel of the teeth. And this is something that typically sticks around for the rest of someone's life, that damage to the teeth. Also, because you are vomiting up different electrolytes, it can lead to electrolyte imbalances, which can negatively affect the heart. Okay, and again, plus there's the psychological effects of this, and feeling like I said, it takes over someone's life. What I experienced myself was probably more on the side of binge eating, and the big difference between bulimia and binge eating disorder, as far as how the disease manifests, is that in binge eating disorder, there is no compensation. So someone binge eats, they have an episode of binge eating, but there's no over-exercising or vomiting or laxatives. And accordingly, there's a higher risk of obesity in this group of people. So people that diet frequently, people that, again, have perhaps genetically distorted appetite regulation or otherwise distorted appetite regulation, and an inability to interpret their hunger and satiety signals, and an obsession with weight as well, these all can predispose to binge eating disorder. And what we see, which is unfortunate, is there's kind of this this relationship also with depression. So let's say someone has obesity, and that increases their risk for depression, and then depression increases the risk for binge eating, which then increases the risk of obesity. So there's this relationship that's hard to get out of when it comes to binge eating disorder and obesity and depression. And that's kind of one of those things where, like, where do we start making a difference? Do we treat the depression first? Do we treat the binge eating first? Do we treat the obesity first? And probably a multi-dimensional approach is best. I picked this slide, this picture from Reddit, because it was posted on binge eating disorder. I follow every kind of nutrition-related subreddit on Reddit because it interests me to see what people post. But someone said, this is binge eating in one photo, because you'll notice there's a lot of weight fluctuations. And although someone might, lose a lot of weight for a time, it often comes back if a person doesn't have this condition managed. And we'll talk about management in a bit. Now, of the eating disorders, the one that we are most concerned about is anorexia nervosa. And anorexia nervosa is quite concerning because this is a disease that has a very high mortality rate. It is a psychiatric disorder with the highest mortality rate. It increases risk of death because people are at a higher risk for committing suicide. And also they are at a higher risk for the complications associated with not consuming enough nutrients and energy that their body needs. So anorexia is a significant restriction in energy intake, leading to an unhealthfully low body weight. So there's not a number we use to distinguish it, but it is when a body weight gets so low that a person's health is compromised. And that low body weight is achieved typically through restriction or other anorexia-associated practices. And what I mean by other practices is individuals with anorexia might overexercise, they might also vomit, they might also binge eat and then vomit, and they might also use laxative as well. There might be a combination of approaches that a person uses when they are in a state of anorexia. But like I keep saying, it's really coming from here more than anything else. It could be due to a feeling of wanting to be in control of something, or lashing out at maybe a relationship in a person's life that isn't working, or a defense mechanism from some sort of history of physical or sexual abuse. Like it's quite serious, typically, the psychological reasons that promote this. So like we see here, individuals with anorexia have an intense fear of weight gain. They feel disturbed by their body weight and shape. They often link body weight and shape with perfectionism, and they want to often achieve perfectionism. They might struggle with self-worth and acceptance. And we also see that they're at a higher risk for amenorrhea, which means a cessation of their period. But like I said, this is something that's quite serious. And if you or someone you know is experiencing this currently, first of all, no judgment for any of these eating disorders. But this is one that we really recommend treatment for. Unfortunately, often people, they don't want to seek treatment. And it often gets worse before it gets better. But people that do seek treatment do often get better, and I really recommend that for anyone that is going through this. Okay, and love to you, love to whatever you're going through. I also want to say that as well. So like I mentioned, there's 3 eating disorders: anorexia, bulimia, and binge eating disorder, which are established and there's lots of research on, and they're recognized by the American Psychiatric Association. But these last 2, they're kind of newer ones, and they're ones that we're still trying to understand, but they nonetheless show up in the Diagnostic and Statistical Manual of the American Psychiatric Association. But like I said, we're still exploring them. So one of these is night eating syndrome. It's currently not recognized as its own eating disorder. And this is something that does increase obesity risk. And what we see in night eating disorder is that people consume more than 25% of their daily calories at night. Right? So they might eat a normal day of food, and then 10 p.m. hits, and then there is an excessive consumption of food. Not necessarily in a binge eating situation, but there's just this high consumption. What we do see that with people with night eating syndrome, they often don't have any hunger in the morning, probably because they ate a lot the night before, and they often have difficulty sleeping as well. Individuals with night eating disorder do have a higher risk of obesity. However, some of them delay eating. They know that they like to eat most of their calories after a certain period of time, so they might delay food intake until later so they can eat at night. Okay? Another eating disorder, which again is not recognized, but this is something that's gaining traction these days, especially these days with our obsession with healthy eating, is something called orthorexia nervosa. So this is an obsession with healthy eating that has negative psychological implications. And no, there's nothing wrong with eating healthy or wanting to eat healthy. The word here that we're a bit concerned about is the obsession word, where wanting to eat healthy kind of is like all-consuming. And it causes psychological distress because it's like, no, I can't eat this, I can't eat that. No, I can't eat sugar, I can't eat gluten, I can't eat this other stuff. No, like there's perhaps an anxiety or an obsession or something else mental that's going on that has a negative effect on that person. Also, orthorexia, part of a negative complication is that it can increase the risk of micronutrient deficiencies. And unsurprisingly, it's believed to be promoted by the societal pressure towards clean eating. So individuals with orthorexia, they might compulsively check nutrition labels, they might cut out foods and have a very restricted amount of foods that they can eat. And again, like I keep saying, it's the mental side of things that make these eating disorders or eating disorders that we're exploring. As far as treatment for eating disorders go, it really depends on the individual. Some individuals get better on their own. I kind of worked through my own binge eating and bulimia. There was a book that really helped me called Overcoming Binge Eating by, I think it's Christopher Fairbaum or Michael Fairbaum. Really, really great book. However, if it is more serious, if it's more consuming, often we do recommend help by a healthcare professional. There are treatment centers like Kelty Treatment Center in BC that help people with eating disorders. Most of the treatments are psychological, so it might involve talking to a psychologist or a registered clinical counselor. Typically, you want to talk to someone who specializes in eating disorders. And in some cases, medications might be prescribed, or they might also use particular psychological therapies like CBT. That's not a type of medication. That should be actually up here. Sorry about that. CBT, cognitive behavioral therapy, it's a type of therapy where we try to change people's thoughts. We want to kind of turn kind of limiting beliefs and limiting thoughts into ones that are more positive and that help them, or they're more coping oriented or beneficial to them, and also changing their behaviors from more limiting behaviors to ones that promote thriving. Okay, so that's all I want to say about eating disorders. Like I said before, no judgments, no matter where you are. And I also mean that with no judgments to other people. If you don't have an eating disorder, it's easy to judge others when we don't understand what they're going through. But usually individuals that are going through eating disorders, they don't often understand what's going on, and they, just need love like all of us. And they might not be ready to get better. And that's why it's important to just be a caring, loving friend for them until perhaps they are. Okay? So some things to think about there, and we will see you in the next unit.